What's up, y'all? It's GC Kinsey, here to share what I learned about navigating the healthcare system while medically transitioning based on my experiences during my first year on testosterone. On the day I took my first dose of testosterone, I made a video about the journey I took to get to that point. And if you haven't seen it, you might want to watch that video before you watch this one, mostly because I'm going to be making a lot of references to things I talked about in that video, so it's probably helpful to have that context. I also want to make it clear that I am not a medical professional. This is all just my perspectives and experiences as a patient. With those disclaimers out of the way, buckle up because this is about to be a long and kind of salty ride as I share 5 lessons I learned in dealing with the healthcare system after starting T. Lesson 1. Being on hormones means coming out to all your healthcare providers. When you go to any kind of medical appointment, one thing they ask you for is a list of all the medications you're currently taking. That's so that if they need to prescribe anything, they can make sure there won't be any interactions with medications you're already on. So if you start transitioning with hormones, what that means is that you'll have to come out to all your healthcare providers the next time you see them and they ask for that list of medications. And I mean all your providers, not just your primary care physician, but also any specialist you see, your dentist, your eye doctor, the ER or urgent care if you have to go there, everyone. And that can be a lot. You end up having to consider things like, will a provider you've had a good long-term relationship with respond in a transphobic way when you come out? Will a provider be accepting on the surface but unconsciously start treating you differently, like conveniently blaming any new health problems you have on your HRT? If you happen to have a relative or friend or coworker who also sees your provider, will that provider know not to out you to them? Or will they just absent-mindedly be like, hey, your son was here the other day, to someone who still only knows you as their daughter? Because a lot of providers don't realize that someone's trans status might be just as personal as any other HIPAA-protected information. And depending on how things go when you come out, will you end up having to find a different provider? Because that can be a massive pain, not to mention disruptive for prescriptions or any other ongoing care you have with them. There are some people who choose not to come out as trans to their healthcare providers when they start HRT, and that usually looks like one of 2 things. Telling the provider they're on HRT but not explaining what it's for, or not telling the provider they're on HRT, so just leaving it off their list of medications. Because of the risk of drug interactions, I never once considered that second option. I told all my providers I was on testosterone, and I can't in good conscience recommend that anyone leave something like that out. But I understand that sometimes it comes down to weighing the risk of drug interactions against the risk of transphobic violence, and those are both very real risks. So I'm not going to judge any trans person for doing whatever they feel is safest for them. But if I didn't want to come out as trans to my providers, I would feel safest going the route of saying I'm on testosterone, but not saying that it's for transition. And if they ask, there are reasons why some cisgender people take cross-sex hormones, believe it or not, so you could always have one of those reasons ready to use as an excuse. I personally didn't want to go that route either. One of my transition goals was to be out to everyone. And I was tired of going to appointments and pretending to be someone I wasn't and feeling extremely dysphoric about it afterwards and feeling guilty for doing that to myself. So when I started T, that was my line in the sand for coming out to all my healthcare providers. In fact, I even came out to one of my providers before starting T just to make sure there wouldn't be any negative health consequences from taking it. If there was any reason that I couldn't be on T, I wanted to know that ahead of time so that I could adjust my transition plan accordingly. But fortunately, my provider gave me the all clear to start T and was respectful of my gender. Respectful doesn't always mean knowledgeable though, which brings me to Lesson 2. You will have to educate your providers on how to treat trans people. If you're receiving gender-affirming care from a transgender health clinic or program, chances are they already have training and experience on working with the trans community. But with any other healthcare providers, it's a total crapshoot, and you will likely have to educate some, if not all of them, about how to treat you. And I mean that in 2 ways. how to treat you in terms of your health, because most providers do everything according to cis-binary standards, and how to treat you with basic respect as a person. Yes, that's sad, but it's the truth. When it comes to how to treat you in terms of your health, as a trans patient, I've found that I have to be knowledgeable and proactive about my health in ways that a lot of cisgender patients probably don't even think about. For example, when I was first looking into testosterone, one of the things I learned was that changes to your hormone profile mean changes to how your blood work needs to be interpreted. Meaning that if you were assigned female at birth, but your testosterone levels are now in standard cis-male ranges, you'll have to talk to your doctor about reviewing your blood work against standard male ranges rather than standard female ranges for certain blood tests to make sure that your results are normal. My local LabCorp automatically runs the results against what's on my ID and insurance card, but that's my legal sex, and it's your physical sex that matters for blood test results. And for many trans and non-binary patients, their legal sex and their physical sex don't match. So I have to know that and remind my doctors about that because, like I said, most doctors are operating on cis-binary standards, and something like that's not going to cross their minds. So that's one way you'll have to educate your providers, by reminding them, hey, my hormone profile or my anatomy is probably not what you're expecting, so let's talk about how that's going to affect the outcome of any treatment you think I need. But the other way you'll have to educate your providers on how to treat you respectfully as a trans person is the one that I've found much more challenging. Whenever I've come out as trans to friends and peers, or in queer spaces, or in cosplay and nerd spaces, the response has generally been the same. It's some form of support, like, hey, that's cool, or thank you for telling me, followed by, what do you want me to call you from now on? Meaning name, pronouns, other gendered terms, etc. When I started coming out to my healthcare providers, the reactions were not bad, but very different from what I've experienced in social settings. Some providers were what I would call politely confused, meaning it was clear that they didn't fully get what I was trying to tell them, but they also didn't want to say anything offensive, so they ended up getting really flustered or just clamming up completely. Some providers were what I would call coolly professional, meaning they took it in stride and didn't show any kind of reaction, positive or negative, just immediately dropped all use of gendered language. Side note, I wish it were standard to avoid using gendered language for patients altogether until or unless the patient brings it up. And finally, some providers were supportive in the sense that they expressed the, hey, that's cool sentiment, but they didn't go any further than that in terms of asking how I should be addressed from then on or offering to update my records, etc. So what all of these reactions taught me was that in healthcare settings, I was going to have to steer the ship entirely. If I wanted a doctor and all their nurses and receptionists to change what name and pronouns and honorifics they were using for me, I was going to have to say so because they weren't going to ask. If I wanted them to update my chart to reflect my transition, I was going to have to request it because they weren't going to offer. And it's kind of difficult to know if that's because that's what they've been trained to do, let their trans patients take the wheel on everything, or if they're not giving any guidance to their trans patients because they haven't been trained on us at all. I suspect it's the latter because I've been in some pretty awkward healthcare situations that clearly stemmed from a lack of training. The worst one by far is just waiting room protocol. I have been misgendered repeatedly in waiting rooms even after coming out to my providers and having them update my records. And I've had to educate both front desk staff and nurses about why misgendering trans patients in the waiting room is not only hurtful but also potentially dangerous. If you're checking in a trans patient and you keep misgendering them within earshot of other patients in the waiting room, or if you call out someone's feminine-sounding birth name and then a masculine-looking person has to stand up and go back, that could paint a target on a trans patient. You don't know if there's some bigot sitting there who realizes what's going on and follows that trans patient to their car later. And with the political climate getting worse on trans issues in the US and many other parts of the world, anti-trans bigotry is ramping up in society at large as well, which makes the world a scary place for trans people to navigate. So even if you've never had training on trans patients before, a little bit of reading the room, literally in the case of the waiting room, goes a long way. Another area where I've dealt with issues stemming from a lack of training is with referrals. For example, if a doctor refers me for a procedure like an MRI or CT scan with another office. What happens is I'll get a call from that other office and they're using my full name instead of my initials, they're using the wrong pronouns, and I have no way of knowing why. It could be for a good reason, like my provider wasn't sure if they should out me to the other office. It could be for a bad reason, like the provider is only gendering me correctly to my face, but misgendering me when I'm not there. It could just be simple oversight, like the provider sent my chart over to the other office without thinking to add any context about my name and pronouns. But the point is, I don't know, which leaves me in the awkward position of having to wonder. And it leaves this new office with a first impression of me that is inaccurate and can never be undone. I generally have a better experience as a new patient somewhere if I get to be the one to introduce myself to them and give them the correct first impression from the beginning. But with referrals, that option is taken away from me, and that's pretty rough. When it comes to educating my providers about my needs as a trans person, one thing I struggle with a lot is the fact that I'm paying them for a service and giving them free education, which they ideally already should have had, and I'm not getting compensated for that in any way. Like, every time I have to do this, a part of me wants to ask, could you at least refund my copay in exchange for the dysphoria you caused me today and the emotional labor I've had to expend on telling you how to treat me like a person? But I know the world doesn't work that way. I also know that if some trans person doesn't stand up and do that work, more trans people are only going to be hurt by the cycle of perpetual ignorance. So that trans person may as well be me. Which means I pretty much just suck it up and remind myself that any trans patient who visits that office after I do is going to benefit from me saying something. Or sometimes I will even benefit from it directly, like when I go back to that office and they treat me better the next time. I've had a couple of nurses tell me that I'm the first trans person they've ever met, which seems impossible statistically. It's much more likely that I'm the first openly trans person they've ever met, not the first trans person, period. But if I ever needed any reassurance that I'm doing the right thing by speaking up and educating my providers, it's that. I'm doing one small part to contribute to a future where someday no trans patient has to worry about whether they're the first trans person their provider has ever met and what that might mean for their treatment. Lesson 3. Health records and computer systems aren't built with trans people in mind. In Lesson 2, I briefly mentioned requesting that your providers update your health records to reflect your transition, but that deserves a whole lesson of its own. Because one thing I've learned is that health records and the computer systems designed to maintain them were not built with trans people in mind, especially if you're non-binary, which I've had to find out the hard way. There are two different angles to this that I want to talk about. The limitations of records and forms and computer systems themselves, and people's willingness to address or work around those limitations. So let's talk about the limitations themselves first. With patient records and charts, there are limitations on how providers can list your gender or document your transition. For example, whenever a nurse at any provider's office went through my chart with me to update it, the chart's gender options were limited. Sometimes to the binary, as in you could pick male, female, transitioning to male, or transitioning to female. Or sometimes non-binary was included, but in a clumsy or outdated way that doesn't actually work. As in you could pick male, female, or prefer not to say. I would prefer to say actually, but you didn't give me a non-binary box to check. The chart's options for language that should be used to refer to you were masculine, feminine, and neutral, which is too oversimplified to work for everyone. Like, if you pick neutral, how do you specify whether you're a they or a ze, for instance? And in my case, I use a combination of masculine and neutral terms. My pronouns are he, him, and my honorific is sir, but my title is mix. No one's chart can handle that, apparently. The charts had a field for assigned sex at birth, and sometimes legal sex, but not physical sex. That leads to providers asking a bunch of health questions based on either your assigned sex or your legal sex that may or may not be relevant for your actual body. with forms like the intake paperwork they give you at appointments or a patient portal you might be asked to set up. Some of the limitations I've encountered include, again, listing male and female as the only gender options, requiring you to pick a gender option that matches what's on your ID and or insurance card, not offering a place to specify what your actual gender is or what name, pronouns, and honorifics you want to be called, and using bioessentialist language, such as, for women, any chance you could be pregnant, yes or no. On paper forms, this is easy to get around because I can cross things out and write things in as needed. But on electronic forms, it's a whole different ballgame. A lot of them won't let you move forward if you don't pick a gender option, for example, even if they don't give you a gender option that's accurate. So that's fun. And that's a good segue into talking about computer systems in healthcare, which have their own set of limitations. I've had receptionists at 2 different doctor's offices tell me that they couldn't update my account to show that I go by my initials rather than my full first name because the computer wouldn't let them without a legal name change reflected on my insurance card. The problem with that, of course, is that I'm not changing my legal name, I'm just going by my initials instead. So that's a scenario that whoever designed these computer systems clearly didn't think about, but it's a real scenario because here I am living it. I also know that a patient doesn't have to have their legal name called out in a waiting room if that's not the name they go by, because I've seen plenty of providers who don't use my full name just because the computer says they have to. So when that came up, I pushed back. And wouldn't you know it, in both cases the computer system totally had a field for a preferred name. The front desk staff had just never been trained on how to find or use it. And training issues aside, what the hell, computer system designers? A patient's preferred name should be the first thing anyone sees about them in their account, not something that's buried and hard to find. Like, what do y'all think the point of a preferred name field is? But the worst limitation about computer systems is that none of them seem to be able to take those fields like preferred name and pronouns and transfer them from one electronic health record to another. In the digital age, where you'd think that would be the #1 reason to make health records electronic in the first place. But nope. Every provider you visit has to update your records separately. In fact, every office you visit has to update them separately. I see one doctor whose practice has multiple offices throughout my city, and he rotates around each one of them. But when the nurses updated my name and pronouns at one office, that information didn't transfer over to any of his other offices. So when I went to see him at a different office, you guessed it, I got misgendered in front of the entire waiting room again. So those are the limitations of charts and forms and records and computer systems, but what makes the biggest difference with navigating those limitations is how willing a provider is to help you deal with them. Are they quick to dismiss your needs and say, the computer just can't do it? Or do they look for workarounds? Or even better, do they offer to try to change their systems to remove those limitations whenever possible? And I'll give you a really cool example of that. I was trying to get my testosterone prescription transferred to a new pharmacy, and I had to give them my full legal name so they could make sure the prescription was for the right person. But I said, just to be clear, I don't want anyone calling me that. The only name I want people calling me is GC. And the person who was helping me said, oh, I don't see a preferred name in our computer system, but we record all of these calls for quality assurance, so I'm stating right now for the recording that the next time we have a system update, we will put in a request for a preferred name field. That was awesome. In a world where most people just throw up their hands and say, I can't do it, this person saw an opportunity to make a positive change and took the initiative to try to make it happen, and I appreciated that so much. So speaking of pharmacies, that brings me to Lesson 4. Pharmacy hell is real. There's a misconception floating around in a lot of more conservative-leaning circles that trans people are just guzzling down hormones like candy, that doctors are pushing it onto us so hard that it's easy to just go get a prescription and start taking HRT the same day. And that could not be further from the truth. Allow me to take you on the journey I've suffered through pharmacy hell. It all started with getting my very first fill of testosterone. First of all, I had to have labs drawn before I could get the prescription, so even though I went the informed consent route, I did not leave Planned Parenthood with a prescription for T that same day. But after I got the labs done and Planned Parenthood gave me the all clear, there was a 3-week delay between when they called the prescription in and when I finally had it in my hands. And that was all thanks to my local Walgreens doing some weird shit that they have never done with any of my other prescriptions ever. First, they left it listed as pending in my account for a whole week. Then they only filled the needles and syringes and not the tea itself. Then when I asked what I was supposed to do with a bunch of needles and syringes and no medication, they said that testosterone requires prior authorization and asked if they should contact my provider to get that. Now, just to illustrate how bizarre this is, a while back, my local ER called me in a prescription for Vicodin to treat the pain from an abscessed tonsil they'd had to drain, and it was ready within a few hours. Half a year later, when I had another abscess forming and needed to get my tonsils taken out, my surgeon called in a prescription for oxycodone for post-surgery pain management, and that was ready within a few hours. Both of these painkillers are controlled substances, more heavily controlled than testosterone actually. They are Schedule 2 while testosterone is Schedule 3. Yet that same Walgreens somehow got prior authorization for 2 heavy-duty narcotics ready within a few hours. And they didn't ask me if they should contact my providers about it, they just did it automatically. So I wonder what could have possibly been behind them letting my tea prescription sit there for a week and not get prior authorization on it until I had to prompt them. And as if that's not bad enough, it sat there pending for 2 more weeks after they requested prior authorization, then disappeared from my account entirely. And it was only when I called to ask what was going on that they finally said, "Oh, we can have that ready for you this afternoon." After I finally picked up that first tea prescription, I thought I had cleared pharmacy hell and that all subsequent refills would be easier from there on out. And boy was I wrong. Walgreens also found some excuse to delay my 3-month refill and my 6-month refill. At 3 months, it was because insurance was flagging it, which made no sense because insurance hadn't flagged the first fill and I hadn't changed insurance plans since then. At 6 months, it was because a different Walgreens location had already filled the prescription by mistake, so I needed to get Planned Parenthood to call it in again. Which really made no sense because I had never given Planned Parenthood any other Walgreens location except that one. Also, what kind of security breach is that? Like, did some other random patient end up with my tea? I have so many questions about this. Anyway, I had to call Planned Parenthood and get them to deal with it, which unfortunately meant even more delays thanks to playing phone tag with their office, but I did get my refill. Eventually. What sucked even more than all these delays, though, was how I got treated by Walgreens staff every time I went to pick up my tea. Getting misgendered every time, which hurts bad enough on its own, but is even worse and, like I said earlier, potentially dangerous when it happens in front of other customers in line. Being questioned about whether I had the right prescription because of the gender marker on my ID. And on my 6-month refill only, having the pharmacist refuse to release the medication to me until I assured her that I would not attempt to get pregnant while taking it. Which, considering that didn't happen with my other refills, definitely felt like a transphobic microaggression. So when it came time for my 9-month refill, I decided I was sick of this and wanted to switch pharmacies. Walgreens had also been pulling some shenanigans around this time frame about refusing to fill the abortion pill even in states where it was legal, so that was just another nail in the coffin for them. One of my other medications was already being filled by a mail-order pharmacy, so I thought, I'll just tell Planned Parenthood to send my refills there. That way I won't have to deal with in-person pickups and all the misgendering and weird transphobia that goes with that ever again. But little did I know that I was only entering pharmacy hell level 2. First, there was a mix-up where Planned Parenthood accidentally called it in to the wrong mail-order pharmacy. Both of them were CVS mail-order pharmacies, so understandable mistake, but because I didn't have an account with the specific CVS mail-order pharmacy that Planned Parenthood had called my prescription into, CVS canceled my refill. When I was able to reach Planned Parenthood and get them to call it into the correct CVS mail-order pharmacy, they left me a voicemail saying that the refill simply didn't go through. Thus commenced several more weeks of phone tag where I tried to get in contact with a person at Planned Parenthood but only ever got a voicemail box. And unfortunately, that's all they ever got when they tried to call me back because they always called when I was in a client meeting at work and couldn't answer. I never did manage to connect directly with a provider at Planned Parenthood, but they did finally get the refill called in to the right CVS pharmacy, and this time it did go through. But then CVS called to tell me that while they could refill my tea, my insurance wouldn't pay for it through their pharmacy. But there was a different mail order pharmacy called Express Scripts where my insurance would pay. So back to Planned Parenthood I went with Express Scripts information. But unfortunately, again, I wasn't able to connect directly to a person and no one responded to my voicemails. CVS and Express Scripts both tried really hard to help me do a direct transfer, but it didn't work because tea is a controlled substance. And neither pharmacy was able to reach a person at Planned Parenthood any more than I was, just voicemail. By this point, it had been 2 months since my 9-month follow-up with Planned Parenthood, and I was getting dangerously close to running out of tea and having to miss a dose. So I finally just caved in and asked CVS what it would cost to get that refill out of pocket. They actually found me a coupon that made it cost only $15 per vial more than it would have with insurance, so that cost wasn't too terrible. And fortunately, it arrived just in time. I actually did run out of tea, but the refill got there 2 days before I was due for my next dose. So that was a relief, but oh my god, the stress. Also, I had to talk to at least a dozen different people between both pharmacies during the process of dealing with all this, and all but 2 of them misgendered me immediately upon hearing my voice. Yes, even at 11 months on tea. Even though they were super nice and apologized and started gendering me correctly after I told them, it still just really hurts to get hit with that over and over and over. Also, it's wild to me that anyone would respond to a caller saying, "Hi, my name is GC Kinsey and I'm calling about my testosterone refill," with, "Sure, Miss Kinsey, we'd be happy to help you with that." I did not give any indication of my gender with my name because it's just initials. I did give a pretty decent indication of my gender by saying I was on testosterone. And even though my voice isn't done changing, it's still the deepest it's ever been, so how the heck do you get Miss out of that? But I digress. The one silver lining in this tale of pharmacy hell is that hopefully, it will all be over soon. I just had my 1-year follow-up with Planned Parenthood, and they were very careful during the appointment about getting all of the correct pharmacy information, and they called in my refill to Express Scripts during my appointment. But I shouldn't have had to wait for that appointment to actually be able to talk to a person. I should be able to get help for issues like this with follow-up calls between appointments if needed. Which brings me to Lesson 5. Continuity of care is hard to come by. In June of 2023, Dr. Devin Price wrote an essay about his experience with top surgery where he brought up a really good point, which is that continuity of care is hard to come by and often outright missing for trans patients, and it's usually only something you get if you can afford to pay for it. I feel like my experience with Planned Parenthood's transgender hormone therapy program really drives that point home. Because as wonderful as their program is, and as well as I've been treated by all the providers and staff members in it, and as grateful as I am that it exists, there's one big thing it's missing, and that's continuity of care. For those of you who may be unfamiliar, continuity of care means that you see the same healthcare provider every time you visit an office or clinic, you establish a provider-patient relationship with them, and they manage your care on an ongoing basis, including follow-up and helping with any specific issues they're treating until they're resolved. By contrast, not having continuity of care looks more like being seen by a different provider every time you visit a particular clinic or office, and not having any sort of consistent follow-ups or ongoing health management. And this can be difficult and frustrating for patients because it requires them to do a lot of extra work, like re-explaining their health histories over and over, or chasing down prescription refills, or doing all their own legwork for follow-ups and tests, etc. Planned Parenthood does not operate on a continuity of care model, at least not in the transgender hormone therapy program at my location. And I didn't realize this at first because I happened to have the same nurse practitioner for my initial testosterone appointment and for my 3-month follow-up. So I thought they actually did offer continuity of care and that same nurse practitioner would monitor my progress on T and adjust my care accordingly. But then I had a different nurse practitioner for my 6-month follow-up, and another different one for my 9-month, and yet another different one for my 12-month. And after my 9-month follow-up, when I was going through that whole pharmacy switching adventure, there were at least 3 different providers trying to make sure that my prescription went to the right place. All of these different providers were wonderful. They were super nice, super respectful, and super helpful. But because I wasn't being seen by the same person this whole time, that unfortunately made it very easy for any kind of follow-up to fall through the cracks. For example, one of the times when I called the clinic about the whole pharmacy switching issue, the receptionist told me that I needed to make an appointment, and I had to explain that no, this was actually follow-up from the 9-month appointment I had already had. So an issue that probably could have been resolved within the same week if you had continuity of care ends up getting dragged out over weeks or months if you don't. And that can risk interruptions to a trans patient's dosing schedule on HRT, which would be detrimental both physically and mentally. Something else that adds a layer of complication onto all of this for Planned Parenthood specifically is that all of their clinics have been much busier since Roe v. Wade was struck down in the US, especially clinics in states that are banning or restricting abortion or other forms of reproductive health care. So that leaves Planned Parenthood with slower than usual response times to their patients because their resources are stretched so thin. And I want to make it extremely clear that I am not knocking Planned Parenthood with any of this. I think they're wonderful and they're providing much needed services for people who are marginalized on multiple different levels. What I'm frustrated with is not the lack of continuity of care at Planned Parenthood, it's the lack of good options for trans patients who need gender-affirming healthcare with continuity and consistency at an affordable price. With Planned Parenthood, you get the affordable price, and you get a program where people are trained on the trans community's needs and offer an informed consent model of care, which is so important considering how much gatekeeping there still is against gender-affirming healthcare. But what you don't get is continuity of care. On the flip side, you might be able to get good continuity of care from an endocrinologist. You would see that same provider for every appointment. But maybe you don't get those visits at an affordable price, or maybe your endocrinologist isn't trained in the trans community and doesn't provide you the best treatment that you could be getting. And based on Dr. Price's essay, it sounds like gender-affirming surgical care has the same problem, but worse, in that it's plastic surgeons who have their own private clinics and don't take insurance who offer the best continuity of care, while trans-focused surgeons who operate in local hospitals and do take insurance often don't have good continuity of care. So that sets up a major barrier for the vast majority of trans patients who can't afford to pay out-of-pocket costs to work with a plastic surgeon. The price they pay instead is lack of continuity of care, which can be especially awful if you have complications from your surgery or need revisions. Access to continuity of care is really a societal issue. It's a systemic problem that needs to change. But the reason I'm talking about it in this video of lessons learned is that if you're trans and you're seeking gender-affirming healthcare, it's important to be aware that this problem exists and to think about how you might want to navigate it. There are no easy answers, and I'm still figuring it out myself. But I didn't know it was such a disproportionate issue for trans patients going in, and now I do, so I'm passing that knowledge along. Alright, that wraps up my 5 lessons learned, and now I'd like to end with some final thoughts. First of all, I know this video has been full of salt, and it's probably easy for some people to watch it and go, wow, you trans people really love to complain about everything. But the thing is, the healthcare system is really difficult for trans people to navigate, and we have every right to be frustrated with that. Anyone would be. The point of this video isn't to sit around and complain, it's to shed light on the sources of those frustrations so that we can work together as a society to make things better. Second, if you work in the healthcare field, the one thing I hope you remember about trans patients is that we don't just need gender-affirming healthcare. We need regular healthcare too, just like any other patient. I get the sense that a lot of medical education programs frame trans patients as something you only have to worry about if you provide hormones or surgery or gender therapy. But trans people also get colds and sore throats. We break bones. We have appendicitis. We need hip or knee replacements. We need therapy, be it physical or mental. Some of us get pregnant. Some of us get cancer. We have all the same healthcare needs as any other human, so we need to be able to access that care without being treated like aliens. And the last thing we want to do when we're already sick or hurt and scared is have to fight to be treated with basic respect. And third, if you're trans, I hope this video has helped you in some way with navigating the healthcare system. It's exhausting. It's not easy. You might have to be the one to blaze a trail for yourself and all other trans patients who come after you. But I hope you remember that no matter what, you deserve access to healthcare from providers who respect you for who you are. And with that, now is where I want to turn the conversation over to you. Do you have any thoughts or advice or personal stories about navigating the healthcare system as a trans patient? What do you wish more providers understood? If you work in healthcare, do you have any insight to share about the training you receive or the computer systems you work with or anything else? And for any of you who want to learn more, what questions do you have about all this? Drop a comment below and let's get a discussion going. You can also reach out to me on other social media. I am GC Kinsey across all platforms. And while you're here, feel free to check out some of my other videos. I have more vlogs like this one about my experiences as a queer person, including a recent one about the physical changes I've experienced during my first year on T, along with cosplay music videos, makeup tutorials, my 1 year on T voice change tracking project, and other pre- and post-testosterone voice recordings, and more right here on this channel. So make sure to like and subscribe so you don't miss anything new. And with that, thank you so much for watching. Thank you so much for all of your support. I hope you took something away from all of these lessons I learned, and I will see you on the next one.